Where where is my, is she on now, Leo? Or where Mary, it's Mary Feldblum. Mary?
I'm on. Can you hear me?
Yes.
Okay. I think I'll be 3 minutes and I'll go it quickly, but I really am going to try and bring in a different perspective from a consumer point of view. Thank you for letting me speak. I know you're exhausted, and I just have to say that it is wonderful that you have devoted an entire day to this very critical issue. As you know, I'm the executive director of the Health Security for New Mexicans campaign that represents 170 diverse organizations and thousands of residents. And there is no question that New Mexico needs a strong consolidations oversight law, one that protects communities from the all too many negative impacts of corporate takeovers. But I want to raise today the urgent need for other legislation aside from this consolidations oversight bill, legislation that is actually complementary to its intent. First, I need to point out that the proposed legislation only addresses future consolidations. A large percentage of our hospitals are definitely controlled by out-of-state companies, whether hospital chains or private equity firms. And there are people in New Mexico who live in Las Cruces, Gallup, Alamogordo, even Santa Fe, that must need that protection because there's a lot of evidence of some negative impacts of hospitals that they need. We also think it's important to include other legal options. Expanding our current whistleblower law to cover all those who work in health facilities is very, very important. It should not just apply to oversight, a future consolidations bill, as was suggested by the superintendent. And as mentioned earlier, the OSI has heard and received numerous complaints from medical professionals about medical practice restrictions. I must give you a quote from Gallup physician Dr. Kathy Mezoff, who the statement was read to LHHSC last year. And what she says, and this is a quote, "The stark reality is that our broken medical system does not allow clinicians to practice as we were trained, to be responsible for the best care of our patients. Moral injury is a constant theme that is being discussed now in medical journals." And on this vein, there's another legal option that actually two of your speakers referred to, and that is passing a corporate practice of medicine law, which prohibits corporations from interfering in clinical decisions that should be made by licensed health professionals. Now, Dr. Braun pointed out that private equity firms are actually taking advantage of the loopholes in existing state laws. So we're seeing a movement, and this includes Texas, North Carolina, and others, New York and California, are strengthening their laws. Oregon is proposing what many consider to be the strongest law proposal in the nation. And Dr. Song is correct. Our state does not have a corporate practice of medicine law. So both whistleblower and corporate practice of medicine laws would actually.
Mary,
Yeah.
I'm going to have to cut you off.
Oh, okay.
Thank you, though.
I wish there was no limit said for testimony, and 3 minutes. I assumed around 3 minutes,
Yeah,
which is standard.
Actually, it's it's really 2 minutes, but since
you mentioned
3, so
it doesn't say so.
Thank you, Mary. All right, everyone. I thank everybody for your participation. It was, like I said, my head's about to explode with all the information we received.